And with us right now is Dr. Gaurav Goswami from Precise Care. Always good to see you.
Thanks, Ken.
It's been a while,
Thank you
actually, but it's great to have you back and to talk about the kind of treatments that you have for people who have joint pain and arthritis and sports injuries. So let's face it, sports injuries nowadays, you used to think, okay, it's like people in their 20s.
Right.
You have such an active community here that can happen here too, just as easily. So first of all, talk about the impact of these type of injuries and the conditions that they can have on people's lives, and then we'll get into the way that you go about helping people.
Absolutely. So thanks for having me, and it's great to reconnect. Basically, with the aging population, we're obviously living longer, and physical activity is an important part of our life. In fact, I feel that being active is what really makes life worth living. Mm-hmm. So, as you mentioned, it's not just young people. People want to stay active and continue to play the sports that they love and they've nourished and developed over the years. And what happens is, along with use and overuse comes some form of wear and tear. And it's not even that somebody has to suffer a catastrophic injury, but it's just, using the joint. If you're playing tennis or golf, you're going to put stress on certain joints. And the more you use them, the more they wear and tear. And that, in our traditional medicine, the recommendation usually is to slow down or cut down on your activities, which comes with a price, because people actually love doing those things.
Exactly, yeah.
And in a lot of ways, I don't look at sports injury or even arthritis as a disease. I look at it more as a form of aging and wear and tear condition. So we looked at, rather than having patients slow down, if there was a solution whereby we can heal and repair the injury without having to undergo open surgery or prolonged rehab, and get the folks active and playing their sports again, is what we really try to help patients with. The patients that come to me really are not looking forward to slowing down.
Exactly.
They're not looking forward to going under the knife and then dealing with the implications of having surgery. They want to be out there playing their sports at whatever level they can play. It's not necessarily just competitive sports, but even just being active, being able to hike, being able to play golf, tennis. So that is where this treatment, which we kind of put together almost 4 years ago now, and then I met you 2 years ago. My initial focus was mostly with patients who had sports injuries, but we also started seeing a lot of patients who were aged but still very active, and they were being recommended joint replacement surgery, which is what they wanted to avoid, even though that surgery has become more common.
Right.
And a lot of folks are able to lead a fairly active life with it, but every patient doesn't want to go through 6-8 months of rehab or deal with the complications.
Exactly.
And that's where we come in.
And what you call it is regenerative medicine, right?
Yeah, regenerative cell therapy.
Yeah. That's what we want to get into, the stem cell therapy, because people who have stem cell therapy, there's a lot of different meanings behind when they in the meaning stem cell. Let's face it.
Right.
All the research is being done with Parkinson's and all that stuff.
Absolutely.
This is totally different, right?
Yes.
Yeah.
Yes.
So briefly explain that. How that works.
Right. So that's one of the first things when I see a patient we talk about is, what does the word stem cell really mean? Because it's got so many different meanings.
Right.
In essence, yes, we all grew from one cell, and then we specialized into different organs. But even as we became adults and we had specialized organs, there were seeds of those stem cells in each one of our organs. In fact, you and I and everybody is alive because of our body's ability to regenerate itself.
Right.
On a daily basis, we renew our organs. So what we were able to do is that especially the bones, the joints, the cartilage, meniscus, ligaments, these structures come from the same family of cells which are found in the blood and fat and bone marrow. So they are capable of regenerating each other. And what we do is we harness enough cells from those organs and put them into the joints so that they're able to heal and repair the joint. So in essence, it's more regenerative cell therapy because we're not getting cells from an outside source, not from another patient. These are all the patient's own cells. And what we are trying to do is reinforce the local cells in the joint or at the site of the injury where they're having a hard time healing because of the injury or the disease. And the extra cells are going to help do the repair job.
And how long does this usually take if someone comes in and starts this treatment?
It's usually done in one. Yeah, it's done in one sitting. And the procedure, they're about at our office for about 3 to 4 hours, out of which their participation is only half the time, because once we collect the tissues, it takes time to process them to the cells, and then we inject the cells, and then they walk out of the office.
And do they have to come back weekly, or?
We do follow them up just to see how their progress is doing, and depending upon how advanced their condition was, there might be a follow-up injection needed at about 4 to 6 weeks. And that's about it.
And if once they have this and it takes and you see a positive outcome, is there another follow-up, let's say in 6 months or a year, or how to?
Absolutely.
Because as you just said, our bodies are always changing. You can help repair something right now,
So we talked about the crux of the treatment, but there is several other ancillary elements we do. We want these patients off of the chemical drugs, so we put them on certain natural treatments. Some cytokines, which are anti-inflammatory agents. And so our follow-up is pretty exhaustive. We continue to see them at 3 months, at 6 months, and if they need some extra help with physical therapy or to work with a trainer just to get back into the sports that they love playing, then we help them coordinate those things. Our goal is plain and simple: is to make the patient active, and and less pain, increase mobility.
Very good. Now, we want to tell some people, before we forget, that you're having a free workshop that's coming up a week from today, right? On the 15th, and that's going to be at 6:30. Your location is down in Newport Beach, right?
Yes, Jamboree and Birch, the exact cross streets. It's just off of 73. It's between 73 and 405. So, patients, it's easy to find.
Yeah, I used to work
there's
right
a Starbucks there
ago.
too.
Here's the information as far as the website, precisecare.com, and the number, 949-387-9991. And if you want to take advantage of this free workshop, do they need to call or just show up?
If they call, it's good, just to, so that we can help them with the directions, give them the instructions, and just if there's any last-minute changes, it's good to always call.
Very good. Really appreciate you coming on.
Thank you.
And seeing you again. Hope we see you again soon.
Absolutely.
And again, Precise Care is located down in Newport Beach, and the number is 949-387-9991, precisecare.com. And that free workshop is next Thursday, a week from this evening at 6:30 on December 15th. Nice to see you.
Thank you, Ken.
All right.
Thanks
we'll be right back. Yeah, I used to work.